Assalamu alaikum. Ma'am, roll number 221. I will be presenting the abstract. So the title of our presentation is Smog Awareness and Knowledge of Precautionary Measures Among the General Population. This study is to know how well people are aware of smog and its hazardous effect and how to evaluate how efficiently people follow preventative measures. It is a cross-sectional study that included the general population of Lahore. The total number of participants were 377, and the data was collected using convenience sampling. Symptom experienced by participants due to smog varied across the board. The general public is aware of smog, its health effect, and preventative measures. That was the conclusion of our research. Social media and educational campaign in institutions could be the most effective medium for spreading awareness about smog to the general public.
My name is Kashyap Sanaula and roll number 74. Introduction. Smoke, which is a kind of air pollution, is formed when smoke and fog are mixed under certain conditions, and that affect the visibility of the surrounding air. Smoke has two types, photochemical smoke and the industrial smoke. Photochemical smoke develops basically when urban areas with vehicular traffics and potential sources are nitrogen dioxide, hydrocarbons, volatile organic compounds with enough sunlight and little movement of air. It is caused by free radical chain mechanism that convert nitric oxide to nitrogen dioxide, which further reacts to produce the ozone. So ozone is the primary pollutant of the photochemical smoke. Industrial smoke occurs when there is foggy environment and cool weather. Industrialization and extensive use of vehicles has increased the incidence of occurring the smoke. Industrialization smoke contains particulate matter, sulfur dioxide, and nitrogen dioxide, carbon monoxide, and sometimes ozone. So basically, smoke has short-term and long-term complications on the health. Short-term health complications include irritation to the skin, eyes, nose, throat, wheezing, and breathing difficulties, dizziness, headache, and nausea. And the long-term complications include respiratory disorders, cardiovascular disorders, and neurological disorders. Children and women are basically more prone to hazards of the smoke. And according to a study, there was a 60% increase in the number of patients that are reported with ocular surface diseases such as eye infection, corneal diseases, and conjunctival diseases. According to NIH, pollution exposure in early pregnancy is linked to miscarriage, and smoke can also decrease the visibility, which can lead to road traffic accidents.
My name is Khadija Abdul, roll number 75. Among the general population of Pakistan, individuals have science qualification have greater knowledge of smoke as compared to that with the art qualification. People with a better socioeconomic status follow more preventive measures to avoid the interaction with smoke pollution. Most people heard of smoke from media news and think that human activities are main cause of heavy smoke. Some pollution has great significant issues since the 2013 in Lahore, the second largest city in Pakistan. Awareness is a way of educating people, recording certain events that are taking place and affecting the lives of people. If people are properly educated, change in behavior can be seen. Our study is about the awareness of smoke among the general population and to know about whether people take necessary precautionary measures to protect themselves from smoke. We evaluated the general population about the smoke and the harmful effects.
Assalamu alaikum. My name is Mahnoor Naeem, roll number 77, and I will be presenting the material and methods part. Our study design was cross-sectional study, and our setting was Lahore. Our study population was general population. Our study duration was from May to November 2022. Our sample size was 377, and we calculated it by using Rao-Soft Campbell calculator, and we kept confidence interval of 95%. And 5% margin of error and 50% response distribution. And as far as our sampling technique is concerned, we used convenience sampling. As far as our sample selection is concerned, we used an inclusion criteria in which we included general population of Lahore from age 18 to 45 years, and that had at least basic education and understanding of English. We excluded all those immigrants from other countries and people suspected of any cognitive or psychiatric impairment, or those who were illiterate.
The name is Mohammad Adil, roll number 222. Now, as far as collection is concerned, we made a 36 item performa, and that was circulated among the population of Lahore. This performa contained three sections. The first one, section A, which contained 9 items, and these 9 items were specially designed to gather demographic data. Now, the second section, section B, contains 16 items that were designed to access the knowledge of population about symptoms and complications of smog. And the last one, section C, contained 11 items to access the awareness about smog. After that, the process of analysis was done by using the tool IBM SPSS version 25.0, and we calculated two quantitative variables, that those were mean and standard deviations, and after that we calculated two categorical variables, those were proportions and percentages.
Assalamu alaikum. I'm Maru, roll number 78, and I'll be presenting a part of the results. So majority of the participants had adequate knowledge about the preventive measures of smoke. Symptoms experienced by the participants due to smoke varied across the board. 63% males and 64.2% females experienced eye irritation during periods of smoke. 53.2% males and 64.7% females experienced breathing problems, whereas 77.5% males and 75% females experienced decreased visibility. Skin allergies, gastritis, and asthma were the major health problems encountered by the participants.
My name is Mashilmin. Roll number 219. The major information medium was personal experience, 37.6% for males and 28.4% for females. News also was a major information medium, 26% for males and 37.7% for females. Social media also played a huge role in providing information, 27.7% males and 29.4% females. 76.9% males and 89.7% females said that wearing face masks helped with protection from smoke. 70.5% males and 86.3% females said that avoiding outdoor activities limited the exposure to smoke. Reducing cars on the roads, 89.6% males and 96.1% females. Deforestation, 85% males and 87.3% females. And renewable resources, 76.9% males and 89.2% females were deemed as the possible way to reduce smoke.
Assalamu alaikum. My name is Muhammad Hamza Abbas. I am roll number 220, and I will present discussion portion of our research. So the smoke is a rising environment health issue which has generated a lot of international attention. Many international cities like Beijing, Delhi, and in Pakistan, Lahore are polluted by smoke. Lahore is actually considered the most polluted city in the world. Right now, the air quality index is used to measure the quality of the air, and the air quality index of Lahore is actually 264, which falls in a very unhealthy category. So the um, smoke is very hazardous in Lahore. So the major symptoms experienced by people were eye irritation and decreased visibility and breathing problems.
Assalamu alaikum, ma'am. This is Khushbakht, roll number 76. According to our study, eye irritation was the common symptom which was experienced during smoke season, and this is also indicated by a case study done in Lahore in 2016. 287 out of 377 respondents experienced decreased visibility, which can hinder traveling and can cause road traffic accidents. As per a study conducted in Asia, normal everyday activities of people were also affected by smoke. Almost 70% respondents said that breathing problems were another major issue faced by them, which is similar to another study conducted in Lahore that cardiopulmonary disorders are increased by smoke. According to our study, respondents came to know about smoke from personal experience, some from TV and social media. Another study conducted on medical students of Lahore also showed that these three were the major means of awareness. Almost 84% respondents believed that wearing masks could prevent them from smoke-related health effects. And a study conducted in China mentioned that masks are a simple way to prevent smoke. And use of renewable resources, reduction of cars on the road, and reforestation can prevent smoke. And according to our study, approximately 70% of respondents claimed that information about smoke should be disseminated through newspaper, and 80% claimed that it should be disseminated through social media.
Assalamu alaikum. This is Minhal Chaudhary, roll number 218. I would like to tell you about the limitations of our study. Most of the participants in our research had either science or arts education who are somewhat aware of smoke and its harmful effects on humans. So the target population should be uneducated, lower class people who do not have much idea regarding the hazardous effects of smoke on human health. So what was the conclusion of the study? Our study concluded that much of the general public is aware of smoke, its health effects, and preventive measures. Educational campaigns and smoke prevention seminars are needed for individuals who might not be aware of its impact. And government officials need to address the situation with the development and implementation of smoke control strategies in Pakistan. So this was it. Thank you.